Welcome to Victim to Victory, the Personal Injury Playbook, the podcast to navigating the complex legal system after an injury. We bring you the expert insights and guidance you need to navigate the legal system with confidence, help you make informed decisions, and get the compensation you deserve. Don't let insurance companies take advantage of you. This podcast is designed to empower you with the knowledge you need to protect yourself and your loved ones. So sit back, relax, and let's start exploring the world of personal injury law together.
Welcome to today's episode of the Personal Injury Playbook. Our guest is Dr. Porter, a board-certified orthopedic surgeon. He specializes in sports medicine, and he performs surgery on knees and shoulders. His main goal is to maximize each patient's recovery by minimizing their pain and bringing them back to normal function. Welcome to the show, David.
Hey, good afternoon. How are you?
I'm doing very well. Before we get started, any questions regarding personal injury or your treatment, can you explain your background and education a little bit for us? And tell us exactly what is an orthopedic surgeon?
All right. So I did my training at Rutgers Medical School, followed by residency in orthopedic surgery in both surgery for a year and orthopedic surgery for additional 4 years at Lenox Hill Hospital in New York City. Subsequent to that, I went to Miami for a fellowship in sports medicine, at which point we worked with multiple professional teams, collegiate teams and high school athletes for sports medicine purposes in the South Florida area. After that, came back to New Jersey, took a first job at in Hackensack with the sports medicine group, and I'm with Progressive Spine and Orthopedics, doing their extremity orthopedics at this point.
So what made you gravitate towards sports medicine, in particular working on knees and shoulders?
I've always been an athlete since I was very young, and going through the different specialties in medical school, I realized that orthopedics was extremely fascinating. I did a lot of trauma and a lot of fracture work at a very high level 1 institute in Newark. And, they get the students and the residents extremely involved. I gravitated towards orthopedic subspecialty. And then within that specialty, you can subspecialize. And I thought treating athletes and young patients who have had, sports-related injuries was fascinating. You work with a lot of young athletes. And additionally, with those types of injuries, they often also occur in middle-aged and elderly patients as well. So the nice thing about my field is that I really can treat people from, very young, 4 or 5 years old, up until, into their 70s or 80s.
So how do you approach patient care, specifically with regards to developing custom treatment plans for each individual patient? Because as you said, you have young kids and you'll have people in their 60s and 70s.
I think with regards to treating a patient, you have to look at each patient individually. There's a patient who is in their mid-50s with a rotator cuff tear could be very different than a patient in their late 50s with a similar rotator cuff tear, or in their early 60s with a rotator cuff tear. So I think it's important that you look at each individual patient individually. I think it's extremely important to go through a process of conservative treatment with a lot of these patients if it's indicated. Of course, if they need surgery fairly urgently, that's something we do. But a lot of patients, at least we give them a chance at a conservative treatment option. And once they kind of fail that course of treatment, we end up taking them to surgery. I think it's very variable, and the younger patients respond very well. They heal extremely quickly. And those are some of the easiest patients to treat in that regard. But with that comes a responsibility of getting them back to playing quickly and getting them back to the field extremely fast. So there's definitely a balance, and there's I think each patient is slightly individualized, despite that there's a generalized protocol for post-operative patients and even preoperative patients.
I'm sure some people watching the podcast would love to know about your experience working with the professional athletic teams, such as the Florida Panthers in hockey, the Heat in the NBA or basketball, and the NFL Miami Dolphins. How was that experience? What did you actually do for them, and how did it influence your practice?
Yeah, so that was a really amazing time that I spent down in Miami doing that. The ability to treat such high-level elite athletes was incredible. I mean, you see a different side of sports medicine. You see these players who are, they're trying to get back to playing and work as soon as possible. There's a high demand for their skills on a team and on, within a league. So it's an interesting insight into the world of professional athletics. Now, with regards to that, while I was down there, I was basically treating. I was essentially an assistant physician for aforementioned teams, and primarily the Dolphins was my main focus. And during that time, I would see a lot of the athletes in the locker room. I would see them post-operatively. We did a fair amount of surgeries on a lot of the players, because a lot of them did get hurt that year. And I was kind of the middleman between at that point and getting them back to recovering, getting them on the proper protocols for physical therapy, and helping them kind of with their athletic trainers, and being sort of an important part of their process and getting back to the game.
You mentioned earlier about conservative care, and that conservative care, that would consist of physical therapy and maybe some injections, whether anti-inflammatory steroids and different things before you would have surgery. So how do you determine whether a patient requires surgical intervention? And what is your approach when you're doing a minimally invasive surgery when it's indicated?
Okay. So a lot of patients who have full thickness tears, for example, within the sports medicine realm, a full thickness tear is oftentimes a pretty big surgical indication. I think if you have a full rotator cuff tear, a full ACL tear, oftentimes a full labral tear in the hip or the shoulder, that can be pretty much surgical immediately. Some of the softer indications or relative indications for surgery are patients who have high-grade tears, for example, a high-grade rotator cuff tear, and they have done a course of physical therapy, they've done a cortisone injection, and they're really not improving. Oftentimes, these partial thickness tears in a high-grade fashion act pretty much like full tears, and full tears don't heal, and they often require surgery. And so that's kind of how I approach it. And I generally give people a chance, particularly if they don't have an absolute surgical indication, like a full thickness tear, to try to get better without, with conservative treatment. So I think it's important to do that. And most people don't want to jump right into surgery. And I think if they feel a little bit better when they know that they've developed a rapport with the doctor, they trust what I have to say at this point when I tell them, hey, I think, now it's time to get you on the surgical schedule. And they feel a little bit more at ease with the outcome. I think that they realize that they've done a course that is not really working, and they know that this is actually something that's going to fix them.
So what's the difference between a minimally invasive procedure and an open surgery?
So we used to do a lot of cases that we do now, ACLs, shoulder rotator cuff repairs. Those would be through an open incision, meaning a small, 3 to 7 centimeter incision, for example, depending on the location. And now, not recently, but over the past 20, 30, 40 years, we've developed arthroscopic techniques through the use of tiny little portals. And, you basically make an incision that's the size of the end of a pen or a pencil. And you're able to put a camera in and multiple instruments inside the joint. And you're able to perform the repairs that used to be very open There was, with these arthroscopic techniques, there's a lot less comorbidities with regards to postoperative infections and postoperative complications due to the fact that you're using such small incisions and such minimally invasive techniques.
Can you tell us about any particularly challenging cases you've encountered in your practice?
I think some of the toughest cases that I have dealt with are some of the total joints that don't have a great reason for having some postoperative pain, for example, where the alignment and the x-rays look perfect and the patient still has some sort of pain. And that happens with a lot of, a handful of patients. And there's a data on that says there's a subset of the population that just, for whatever reason, doesn't do as well as some of the others. And so those are the toughest patients for me. I think some of the other difficult cases that I've had are patients they might have comorbidities like diabetes or high blood pressure or heart disease, and they end up developing postoperative complications like an infection, which are generally tough to deal with for the patient. It's oftentimes fairly easy to treat as a physician, but dealing with patients who have complications is never the easiest thing. It's balance between discussing why this happened and trying to treat this appropriately and making sure the patient gets back to full recovery. And sometimes it leads to a little bit of a delay in their overall recovery. So it's sometimes a little challenging for the patient, but I think with good communication with the doctor and the patient, I think most people have, at least in my hands, have dealt with any of their post-op complications fairly well.
And how do you stay current with advances in orthopedic surgery and sports medicine? And can you tell us about any recent articles or research that have contributed in these fields?
So it's important, I think, to keep up with the literature. So there's a few journals that come out every month or every other month that are specific to sports medicine, specific to orthopedics, that give you the latest kind of insight into some of the most recent articles published. I think that that's pretty important to kind of keep up on. Also, doing yearly, we have a yearly annual meeting that kind of is in different locations each year, and most of the orthopedic surgeons in this country go, and you go to these seminars and you learn about the latest research, tips and tricks on how to do certain operations or changes in management of things. And the field of medicine is constantly changing and evolving, and there's a lot of new evolving techniques, a lot of technology that's coming out. And I think it's important to stay sort of current with all of that, and that's one way that I'm able to do so. I think with regards to kind of newer data, I think there's a lot of new data coming out on ACL, the new ACL techniques that are being performed, a lot of new ways that the grafts, for example, for these patients are being harvested, techniques that were previously thought to be somewhat a little bit unusual are now becoming in favor. And there's new techniques with the different companies in order to perform these surgeries at a much easier way than it was previously done. So I think stuff like that is really interesting and cutting edge.
You spoke of doing some minimally invasive procedures. And what parts of the body do you operate on? You also mentioned doing replacement surgery. So what actually do you do, doctor?
I tend to focus mostly on minimally invasive surgeries, such as rotator cuff, arthroscopic shoulder surgery, arthroscopic knee surgery like ACLs. I also do hip arthroscopy. And with these patients, a lot of these patients end up needing at some point, a total knee, a total hip, or a total shoulder. So I also do a fair share of total joint replacements for those three joints. But the majority of my practice is still sports medicine based.
Now, with regard to personal injury cases, can you speak of any ethical considerations that may arise in your practice as an orthopedic surgeon, especially with regard to patient care and decision making?
Yeah, I think By and large, I think most of my patients who I treat who are personal injury cases, generally, there's not really much of an issue. However, at times there can be a secondary gain uh, with a lot of these patients, and it's fairly obvious. And I think that, for me, I at least like to give patients an opportunity if, for example, they don't have an absolute indication for surgery. I'd like to give them a chance at conservative care because I think that that's the right thing to do. I don't think patients who have a partial tear or a low grade tear or something along those lines, the right thing to do is to jump right into surgery right away. And sometimes that can be a little challenging with some of these patients who want surgery right away. But my goal and my job is to educate patients on what their MRI shows, what their clinical findings are, and discuss with them that if we don't see any improvement overall, I think at that point I would feel comfortable doing surgery on you. But to jump right into surgery initially with something that's not an absolute surgical indication, is not I don't think is an ethical way to practice.
What are the most common injuries that you see to either knees or shoulders regarding personal injury cases, such as a slip and fall, an automobile accident, even a construction accident where somebody falls from heights? What kind of injuries are you seeing in the personal injury realm?
I think some of the most common cases that I see are patients who have meniscus tears in their knees, shoulder rotator cuff tears or labral tears is probably the most common shoulder injury. And depending on the velocity of the car accident, sometimes patients get fractures of sorts. But with regards to just the minimally invasive surgery that I perform, most of it focuses on the knees and the shoulders. Occasionally patients end up developing or have an ACL tear, for example, if they have a big twisting injury or a fall or they're hit by a car. But that's less common in just standard motor vehicle accidents where the patient's a driver or passenger in a vehicle.
And how do you work with other healthcare providers, say a physical therapist, or even somebody who specializes, another orthopedist who specializes in neck or back pain? How do you deal with those cases?
I think it's good to have good dialogue with these therapists. I like to stay in touch with them, and most of them have my direct number. They're able to reach me. I like to know if there's any postoperative issues that are arising and address them pretty quickly, as opposed to kind of waiting to see them at the usual standard post-op 6 weeks or 3 months. So, most of these, patients I tend to see at intervals post-operatively. And if they're not doing well, I reach out to the physical therapist. I make sure that they're doing the proper exercises, make sure that they have the proper protocol. And, some patients are a little bit slower than others post-operatively in healing. But as long as they're kind of on the right track, I at least like to make sure of that. And that's something that, I try to keep an open flow of communication with both doctors and physical therapists.
And with regard to the care that you're giving at Progressive Spine, do you ever refer to another physician in the group if there's a neck or back complaint?
Yes, I think, oftentimes a lot of these patients do come in with multiple complaints. Neck and back issues are extremely common with any personal injury case. And so, I generally refer them for that to, a non-operative spine doctor or physiatrist who can kind of work them up with regards to physical therapy, MRIs of the neck and the back. And then, if they do in fact need a surgeon, they get sort of upgraded to the spine surgeon for treatment. But we do have that within our practice, and we're able to, we have a multi-specialty practice within our orthopedic practice. So we're able to kind of keep the patients within under one umbrella, and it's a much better way of communication, and everybody's sort of on the same page with regards to the patient's treatment.
And can you speak of any challenges that you have encountered in your practice, particularly in regards to patients with long-term or just chronic pain, and what do you do for them?
Yeah, I mean, patients with chronic pain are obviously a pretty big challenge. You could do a surgery that seems in your eyes to be pretty perfect. You think the postoperative course was as good as it could be, and yet they just somehow just don't seem to be getting better. There is definitely a component of pain syndromes that occur with patients that are really not explainable. Some patients just have a chronic pain syndrome after surgery or after an accident, and that's tough to deal with, I think, on from any point of view. Even physicians who see this all the time, like pain management specialists. So, if I'm concerned about a chronic pain issue or a patients who are developing fibromyalgia or chronic pain syndrome, I generally tend to refer them fairly early in the course to a pain management specialist who can treat that. And there's multiple medications and treatment options to get these patients on, early on. And I think the key is to really see this early and treat it early and aggressively. And oftentimes it gets better, but sometimes it doesn't. And those patients are unfortunately just tough to deal with in the long term. And even with pain management doctors, they still have a chronic pain syndrome that just tends to not really get that much better.
Now, if somebody comes to you that was just involved in a personal injury case, whether it's a slip and fall, auto accident, construction, take me through the process when you first see this patient.
So the patient comes into the office, and generally they have, like I said, they generally have multiple complaints, particularly neck, back, usually some extremity pain. My goal is to kind of at first see what complaints and what body parts are being affected, focus on the most troubling areas. Some areas will get better with just time, and as like a bad bruise or a sprain or something along those lines, and those patients will get better with regards to that fairly quickly. Body areas that do not get better over the course of a 6-week course of anti-inflammatories and physical therapy. I generally see these people back at about 6 weeks, and at that point, most of the injuries have kind of declared themselves. And I think that if you have a tear, it's not going to get better at that point, most likely. And those at that point, the patient needs an MRI. And so at that point, I generally order MRIs, and then we'll send to subspecialists within orthopedics, physiatrists, pain management specialists, physical therapists, chiropractors, in order to get a multimodal approach to treating the patient.
That's great. Now, I'm sure some of the people watching this podcast would love to hear about any stories or anecdotes you could tell us about some of the professional athletes. Of course, can't tell us their name, but if there's any situation that presented itself that you'd like to share that may be a little bit unusual or humorous for the people watching.
Well, yeah, one of my first days on the sidelines in training camp, one of the big linemen actually tore his biceps, and as you can imagine, his arm was about the size of my leg, and so kind of feeling anything at that point in an acute setting right after it had happened was a little bit difficult, and so these guys are built differently, and he didn't want to sit on the sideline. He wanted to get right back. He said he was fine. He went back out and started playing, and then the next day we got an MRI, and it turns out he had a distal biceps tear, and he ended up having surgery, which I did within the week, and it sidelined him for probably about 3 months, so close to the full season. And over the course of his postoperative course, we kind of became tight, as you can imagine. I was seeing him a fair amount in the locker room, and once I moved back to New York, he ended up getting drafted by the Giants a year or two later, and I think he had a Super Bowl somewhere along the lines, and then got drafted to the Giants or traded to the Giants. And so I'd seen him up in New York, and it was everything kind of came full circle. But really great player, good guy, and it was definitely an alarm, a rude awakening when I had first gotten out there and realized how these athletes play and perform, and their expectations to get back to the field. So
who are the toughest athletes Because you were around the hockey players, the basketball players, and the football players. Who were the toughest?
I think the hockey players take the cake. Those guys are a different breed of animal, and they really they want to get back out there after getting a puck to the face and a couple stitches, and they want to go right back out there. So it's impressive, and it's not as watched as football, obviously, but they're incredible athletes, and they're just it's incredible to see them playing.
And I had some experience when I was younger, hanging out with some of the New Jersey Devils. Those guys are a bunch of characters. When you get them off the ice, they are hysterical too. They like to have a good time.
Yeah, they do.
All right, Doc. Well, I appreciate your time. We're all finished here today, and I wish you well in your future endeavors, and keep taking care of the victims of personal injury cases and turning them into victories for them. Thank you very much, Doc.
Thank you very much. I appreciate it. Appreciate your time.
All right.
Thank you for tuning in to Victim to Victory, the Personal Injury Playbook. We hope you found today's discussion insightful and helpful as you navigate the complex legal system. If you or someone you know suffered from a personal injury, don't hesitate to reach out to us at 1-800-489-0004. Our team is here to help take you from victim to victory. Remember, taking legal action after a personal injury is a critical step in protecting your rights and securing your future. So don't wait. Make the call today and let us help you fight for the compensation you deserve. We'll be back next week with more expert insights and information.
This podcast is intended for informational and educational purposes only and should not be considered legal advice. The content of this podcast is based on the laws and regulations of the United States and may not be applicable in other jurisdictions. Additionally, any information shared on this podcast is not protected by attorney-client privilege or any other type of confidentiality. Remember, this podcast is for informational and educational purposes only and should not be considered legal advice.